So here we have Stewart's MRI scan. Now, 20 years ago or so, Stewart had a microdiscectomy operation to shave a portion of the disc away, which was compressing on one of the nerves, and this was successful at the time. But over the time, the discs have become a bit more thinned, and in particular, you can see the last two discs in his spine that we circled here on the right-hand side of your screen have become a bit more thinned and then started to compress those nerves again. Now, Stewart was keen to avoid an operation. Further surgery probably would have been involving possibly a fusion operation to one or both of those discs, so he was keen to avoid that. Now, when we looked at his MRI scan, what we could see on there, that on the what we circled on the left side of our screen, which is the right side of the patient, that was compressing some of the nerves more so on the right hand side, and that was correlating with how his right leg was a bit worse than his left. So we were confident that the IDD therapy probably would be something to try and would be something worth to consider instead of surgery. So we proceeded with his course of treatment. We're happy to proceed with that. This is what's called a level 3 category disc lesion. So we knew it was going to be taking quite a few sessions. We were going to be targeting the lowest disc first. But now we can hear from Stewart as to how that course went.
Stewart, you came to us for the IDD treatment. Could you just tell us what the symptoms were that you had prior to the treatment?
So I had really bad back pain which travelled down both legs and went as far as my feet sometimes.
Okay, and what was that stopping you from doing that you wanted to do? What sort of things?
Pretty much everything, normal day-to-day activities. Yeah, it was really disabling for me.
Okay, so you've had your course of sessions now, and how are things now?
Much better, really improved. I can pretty much do everything again. The pain has gone and only sometimes comes back, but that's only when I overdo it and do too much. But then the main difference is it then goes away, whereas it didn't even go away before I had the treatment.
So Stewart, is it fair to say that it took a reasonable number of sessions though for you to feel that improvement, and that it's the message to get to people is it's worth sticking to the course, and at least getting through really to that midway point until you expect to feel some improvement?
Yeah, in my experience, I actually got quite a lot of improvement very, very quickly from this treatment, and I was actually pain-free, and then the pain came back. So obviously I continued with the treatments, and it took a while for the pain to go again. So you do think to yourself, okay, is this working? But you have to persevere with it because it does take several treatments and then it does work.
Yeah, because initially what happens is you get the pressure coming off the nerve, which is I think why you feel the initial improvement, but then for the disc to improve is what takes a fair few more sessions for that improvement to kick in, which I think is what you experienced.
Yeah,
and would you recommend IDD therapy to people who are thinking about having it done? What would you?
100%, because it's such a controlled stretch that I just don't know how you would get that treatment without that machine. So it's really, really good.
Okay, and lastly, what made you choose Spine Plus in particular?
Because I've always been treated by Spine Plus for many, many years, and I've always had great service and great treatment.